Ready, one, two, three, start.
Friends, I am Dr. G.K. Sinha, veterinarian working at Apollo College of Veterinary Medicine, Jaipur. Today, I will be talking to you regarding cranial nerves. Cranial nerves, you see, this originate from brain, and I feel that the veterinary practitioners who are treating the animals and especially canine, especially dogs, it is very necessary for them to know about all the cranial nerves emerging from brain. Now, you see, there are 12 cranial nerves. I think you are aware of it. I'll be talking about first. First cranial nerve is olfactory, and this is you see some disturbance, some weakness of olfactory nerve will result into loss of ability to smell. Why I am telling you? Because suppose a dog has come to your clinic and the owner is reporting that his smelling power has gone. So immediately you feel, if you have this much of knowledge, that the dog is not smelling in a proper way and smelling power has been lost. So immediately you feel that you come to a point that olfactory nerve is affected. This will help you in treatment of the case. Second, cranial nerves is optic nerve, which causes loss of vision, and in this case pupil of the eye is dilated. It's very important. Just by examining by you, when you examine the dog and you feel that the loss of vision is there, the dog properly cannot see and the pupil is dilated, then this is the optic nerve is affected. Third cranial nerve is oculomotor. As the name indicates, oculomotor. This will cause loss of pupillary light, reflects on affected side. If it is on loss of pupillary light is there, then the reflexes on the affected side. Secondly, trochlear. Trochlear is very important. Trochlear, this results into slight dorsomedial eye rotation. Very important point. The fifth is cranial nerve is very, very important from clinical point of view. This is trigeminal. Now, what does it? If there is some injury, there is some loss, weakness of the nerve, trigeminal nerve, then this will cause atrophy of temporal and masseter muscles, loss of jaw, tone, and strength also is lost. Dropped jaw, you see, very important. You see, the lower jaw of the dog will be dropped. You feel that it has become loose and it has dropped. Now, then this will also cause loss of sensation and analgesia to innervated areas. Then face, eyelids, cornea, and nasal mucosa. There will be something weakness you can find in that. Then I come to abducent nerve. This is called sixth cranial nerve. It has when this nerve is affected, what it will do? It will do poor retraction of globe, medial strabismus, and impaired lateral gaze. So this is this symptoms is related to abducent nerve. Then very important, this is of high clinical importance. Please remember this. This is I'm talking about the seventh nerve, which is facial nerve, and many of us, all veterinarians, even the doctors and everybody, they know about. This will cause a lesion. This will cause symptoms in lip, eyelid, and ear droop. Loss of ability to blink. Blinking is like this. This is known as blinking. loss of ability to retract up. Then this will the ability to retract lip. Matlab, the meaning is that lip the dog cannot retraction. Retraction will be lost there. Then tear production will be also lost. Very less tear production or almost nil, and decreased possibility. Next, next nerve I'll be talking is vestibular cochlear nerve. This is eighth nerve, and this will cause ataxia. You see, I'm telling you that during my practice also, many cases of ataxia in the dog I have seen, and this is important symptoms and very important. Now please listen. This will cause head tilt, means turning of the head like this, turning of the head like this. So by just seeing the dog, you can diagnose that there is a head tilt and the vestibulocochlear nerve is affected, and accordingly treatment can be done. Then I am come to important nerve, that is ninth, that is glossopharyngeal. Now, as the name indicates, this will cause loss of gag reflex and dysphagia. Dysphagia we know already, difficulty in swallowing. Then I come to very important nerves in all the animals, including dog. That is 10th nerve, and that we call it vagus. What it will do? This will cause loss of gag reflex, laryngeal paralysis. It's a very, you see, once there is a laryngeal paralysis, then the dog will not be barking, no barking by the dog. So immediately we come to the point that the vagus nerve is affected and dysphagia will be also there. Then I come to accessory nerve, that is 11th nerve, that is, this will result into atrophy of trapezius, then sternocephalicus and brachiocephalicus. These portion of the body of the dog will be affected, and muscles, brachiocephalicus muscles will be affected. Then last, I am talking about, which I think you know about it, is 12th nerve, and that is hypoglossal. As the name indicates, it is below the glossal, hypoglossal. This will affect tongue. Tongue is very important. Actually, these all activities in the mouth cavity is done by tongue. So that there will be a loss of movement, and tongue in many cases, when the nerve is very weak or have paralyzed, then the tongue will be hanging one side of the mouth. So this is very important, and I hope that these what I have described will be helpful to you in day-to-day practice while treating the pet. Now I conclude by saying that my talk will be useful for all veterinarians, all veterinary doctors, veterinary students, and dog lovers and pet owners. Now, because only today is the 2nd January, with the new year, I wish everybody, all listeners, a very happy new year. Thank you very much for listening me.